Understand your health. When was the last time you talked to your doctor about inherited traits that make you more vulnerable to certain illnesses? We invite you to join the Genius community by signing up at buyusforall.com. As a Genius member, you will receive a personalized health risk assessment that helps start the conversation with your doctor. Hello, and thank you for joining us for our special Founders Live episode. I'm going to bring everybody here into the room. We have Dr. Kameron Matthews joining us, so very excited to see you. Hello, Dr. Matthews. Thank you for joining us. How are you?
Hi, Maria. How are you?
Welcome.
Thank you.
We're so excited to have you here, especially for this members only event. You know, we're building the membership in our Genius community and helping people focus on their health. You know, and it's just such an important topic. So we're excited to talk to you today about health disparities. Before we get started, just into that presentation, we wanted to take a minute and acknowledge the death of Chelsea Chris. She died by suicide earlier this week, and you know, mental health is one of the areas that we focus on as a community. So I just wanted to give members of the panel, especially Yusuf, our CEO, an opportunity to just talk about it for a minute before we jump into the full presentation.
Thanks, Maria. Welcome, Dr. Matthews. Great to have you. Great to see the rest of the team. Condolences out to the family of Chelsea Chris. Gone too soon. As you know, mental health is a big component of what we do here at Indigenous Health. Previously, a lot of this work, as Dr. Matthews knows, has been in our veteran community as well. This is something that's near and dear to my heart. The statistics is pretty dire, where, women and veterans are committing suicide at an alarming rate. And trauma is a big component. Don't know what Ms. Chris was going through, but studies have shown that women are twice as likely to develop PTSD due to trauma. And so, we won't know, the inner details of what led her to commit suicide. But, condolence to the family. And we want to focus on a lot of the mental health issues that, COVID has brought over the last year and a half, especially in our communities. And I know Dr. Matthews and Michael and Dr. Wilson, we're all going to jump in and talk about health disparities. But just wanted to take that time in a few minutes just to highlight the fact of her passing and how important it is. And so we've included a suicide prevention lifeline number at the bottom here for anybody that's going through crisis currently right now. So thank you.
Yeah, thank you. Thanks so much, Yusuf. I'm going to now pass the ball to Michael to do some company updates.
Sure thing. Thanks, Maria. Thanks, Yusuf, and welcome again, Dr. Matthews. Thanks for being with us. And ultimately, the first update is that earlier today we did announce both Dr. Matthews and Dr. Nekwachi joining our Impact Advisory Board. We are very, very excited and humbled that essentially two giants of industry with experience at OMB and the VA and now in the private sector have decided to come on board and help us with this mission, with this movement, to try and make a big difference as it relates to health disparities, healthcare in general, within communities of color, and even globally. So we're very excited with this first update. And part of the conversation today, we'll get into some of Dr. Matthews' background. The second update is really that as we step into Black History Month, we have a lot in store for our community. Excited to share it, both on the technology front as well as on the additional advisor front, and as relates to some partnerships that we've been working on. On the technology front specifically, we have several updates that I've been taking a look at and been sharing with the team. So excited to share that publicly with our app and some of the new features that we're going to have that will really get at engaging people and meeting them where they are. So we're really excited to have that come out during Black History Month. And then finally, really wanted to, not that I can do it enough justice, but try my best to properly introduce Dr. Matthews before we get into our conversation on health disparities in the Black community. So Dr. Matthews and I had the pleasure of working while I was at the VA during the heyday of the Mission Act and even a little bit before that. And so really got to see her passion and her wisdom and grit and all of what it takes to survive and succeed in probably one of the most rewarding and challenging spaces to try and do anything. And so, from there, she moved on to being the chief medical officer of the Department of Veterans Affairs, the Health Administration, which, for folks who don't know, is the largest integrated delivery system in the United States. No small feat. And now she has taken the next step into the private sector as the chief health officer of CityBlock, which is a value-based healthcare company focused on Medicaid, dual eligible, and lower income Medicare populations. And so we're excited that she has decided to not only join our Impact Advisor Board, but to be a special guest on this Founders Live, where we intend to really get at the truth behind health disparities and what some of the things are that we may do to try and make a difference. So welcome, Dr. Matthews.
Thank you, Michael. Thank you, Yusuf, Dr. Wilson, Madia. This is I'm really honored. I was actually I won't say speechless, but I was definitely like, really? You want me to be on this Impact Advisory Board? I was like, I don't know that I would be able to add a lot to the conversation, but actually I do think I can. Actually, really thinking about, not because of me, but because of your mission and how really focused and aligned it really is with a lot of the work that I've done and hope to continue to do along your side. So I'm just really grateful. Thank you for allowing me to join.
Yeah.
Amazing.
I'm happy to have another woman just in this forum, because normally we're just here frowning at each other. So I'm happy for other reasons. I'm happy to have you. I discovered you on LinkedIn. Michael sent us a link to the top. You're included in the 2022 top health voices, right, on LinkedIn.
Yeah.
And I went through and I just started reading some of your posts, and I was like, she is about it. Like, she is serious, about health equity. And a lot of the articles you post are informative, and helpful. We've even reposted them from the company. So that perspective that you bring is wonderful. We are really excited to have you.
Thank you. I love the I think multiple different audiences that have started following me, and now I'm getting a little bit of an international attention, which is fun.
Yes.
I'm noticing a lot more interesting comments. I'll say it like that. But I think part of the thrill is that, like, I'm a little too old to have been involved with other social media platforms in the way that, a lot of others have, and I just haven't gotten into it. But on LinkedIn, I just feel like it's a platform to really share a great deal of information, to take it to that next level. So you'll notice I'm always actually, quoting a real article, providing some data. If there's commentary, I'm purposefully being challenging. And I love that with those multiple audiences, I actually get a lot of people who are pushing back. I posted something on about Black Lives Matter, an article that two of my friends actually published. And I have people in the comments, posting all lives matter and everything in response. And I say, bring it. Let's have the conversation. So right. I'm having fun on LinkedIn.
That's great.
Yeah, the internet is a strange place.
I have a lot of fun on LinkedIn too.
Oh my goodness, too much fun. To kick off the topic of health disparities, we have a slide. It's going to cover all of us for a minute, but I think Michael wanted to kick it off with this, this article and slide.
Sure. So the context here, as everyone knows, is sort of twofold. One, Black people and other communities of color, our folks are dying way too young, being exposed to too much suffering and trauma. So the headlines show it, the data shows it. But on the other side, which is this chart that shows health outcomes, factors, policies, and programs, it really highlights what a lot of folks in healthcare know, which is clinical care is only a small part of what helps people achieve good health outcomes. And so, in as much as we are talking about health disparities, I think we have to really look at what in our society is causing the prevalence of some of these health behaviors, social and economic factors, and all these things that are not related to clinical care that's ultimately impacting people's health outcomes. And it could be on any of those levels. So wanted to just flash it because I know everyone here is steeped in this knowledge. So that's why we're looking forward to having a pretty healthy conversation on this topic.
Michael, I'm already ready to jump in and push back. May I?
Yeah. Yes, please.
Oh,
yes, please.
man.
Let's go.
No, not even push back, to expand.
Expand. Yes, please.
Expand.
I'm like, push back.
I actually strongly argue that a lot of those, what we call social determinants of health, are directly related to clinical care. And I think it's even gotten to the point of it being quite predatory as far as, Taco Bell and McDonald's love just opening up shops down the street from a lot of our communities within our communities. But yet we're expecting our community members to then, change their diets and exercise in neighborhoods, perhaps where it may not necessarily have, appropriately paved sidewalks and things like that. So how are we actually expecting to help them clinically, if indeed socially, from a social justice point of view, our larger society isn't helping them. So I actually do think this is directly part of their clinical care.
So maybe I didn't say it properly. So how is it directly part of their clinical care if it's not clinical?
It is clinical. I do think it's clinical. What they eat is actually directly related to their diagnosis of diabetes, obesity, hypertension.
Mm-hmm.
So is it then you're proposing that every decision is considered in the context of clinical care? Because these are things that I think society can take care of without getting in the mix from the health system standpoint.
I think, yes, society can take care of them. I think the point is that they all impact healthcare. So it's not whether or not it's a clinical solution. Yes, a clinical solution might be in the form of a medication, but it's also in the form of me telling my patient, don't eat that McDonald's. Yes. So, I think it's broader than just recognizing that clinical care alone is only focused on what medicine can directly treat, but that we need to be thinking about prevention. We need to be thinking about the longer term exposures, the ridiculous environments that we find our people in, and how it's actually causing disease.
I'll let someone else jump in, but we can do this all night. But go ahead, Yusuf. I
completely agree. I think what we start to see, the impact of food deserts just being. I mean, again, I think I agree that a lot of the policy. That's why I was super excited to have Dr. Matthews and Desi join our board, because last year when we did a hackathon, trust and the policy was some of the key areas. And yeah, you're right. You're putting a Band-Aid on. If somebody comes in, you treat them for something, but they're going right back into the environment. Exactly. That they're gonna have to go get, because of their low income and inability to get fruits and vegetables. You already know that you're gonna have that readmission patient, in a couple of weeks, maybe a couple of months, if they decide to change their lifestyle. But I think society as a whole has not really understood that these are folks that don't have any choice.
Mhm.
I think, some of the things that I've seen being in some of the inner cities, like, Jamaica and then coming here to the States in Miami, New York. I mean, it was just awful trying to go on Kingsbridge Avenue by the VA, the Bronx VA, and see the state of what the fruits look like that
Mhm.
were available for sale. I
Mm.
mean, most people don't really understand how bad those fruits look. And those are some of the things that, again, I didn't even want to buy them, even though I wanted to get some fruits, but I was
Right.
leaving work and was trying to, stop in the neighborhoods, and you could kind of see, where, it makes, and the expense of it. Some folks just have a few dollars in order to feed a family. And then at McDonald's, that dollar menu starts to get real attractive.
Sure is.
Mhm.
But we know what the repercussions are. And so, again, I think, to echo what Dr. Matthews is saying, I think a lot of these things are intentional. And so, those are areas that, we'll like to focus on along with the healthcare, of course. But if we can't get to the root of what's really causing a lot of these, these health issues, we know, again, eating McDonald's, 2 or 3 times a day is a problem. And then, again, even with what the Biden administration just did as far as making sure that lunch and food was accessible to kids, because that was their primary
Exactly.
source of
Yeah.
meal for
Mhm.
the day. So
Mhm.
just imagine what COVID has done to our
Yeah.
community, with the fact that they don't even have access to the meals at school because COVID had them, at home.
Mhm.
So yeah, I'll let anybody else chime in. I could go all day too.
I mean, you can even take it beyond. I think food is a nice and easy one, and that's directly, of course, attributable to obesity and diabetes and hypertension, high blood pressure. But then you could take it to environmental factors, right? So it
Mm.
doesn't even have to be the food, because someone might argue that it's the decision for that person to eat that burger. While we know, of course, there's reasons why, as you already mentioned, Yusuf, there's financial reasons there. But environmentally, I mean, we can talk about the water in Flint. We can talk about the air in any of our inner cities. We can talk about even temperature differences in a lot of inner cities as well, too. We can talk about higher rates of asthma in children in inner cities because of the dust and dust mites in their apartments. I mean, that's directly attributable to your environment. And there's unfortunately oftentimes a lot of very little changes that we can actually impact as individual community members. Your landlord isn't going to clean up after those dust mites usually, and we know they're not doing anything about the water in Flint. So I think these social determinants are directly related to the disease in our communities, and I think unfortunately the healthcare establishment is only prepared to put a Band-Aid on it.
Mm.
Yeah, Dr. Matthews, I'd take it even a step further. Some would argue that food is medicine, right? In terms of right, in terms of all of the things that nature's provided us, in terms of the different colors of things that we eat and how colorful our plates are, directly correlating to our health generally. And then the environmental factors one step further as well, right? You have the physical environmental factors, let's say, like you said, pollution and water. Sanitation, et cetera. But then you talk about emotional environment, the state that the mental state that Black people walk around with under, particularly Black males, when, we're faced with the reality that at any given point of time, we could be in danger of losing our life as a result of an interaction with some law enforcement officer who's had a bad day, right? So that's some additional factors that you can layer on top of all of this. So
yeah, I'll be more than happy to name it. Underlying causes: systemic racism is a bunch of what everyone's talking about, and then poverty. And so ultimately, the health system in America is eating 22% of our GDP directly and probably 40 to 50% indirectly. And so it's a lot of big corporations and nonprofits making money. And so when you start talking about investing some of that money somewhere else, It's not a conversation they're willing to entertain. So that's what health that's what we're basically up against.
Yeah. And for me, until we change, really, I mean, this is why I chose to come to City Block. But until we really change the way we're incentivized to pay for healthcare, we're not going to change that business model.
Yep, that's exactly right. That's exactly right. And all of the people that are standing in the way, that's who we have to worry about.
Can I just want to run us back because this is a special members only, session. So I want to make sure members know that they can ask questions, but also can you all, if somebody's not in the field of health disparities, how do you explain kind of what that is, like the actual definition? What does it mean? What does health disparities mean?
I'll let one of our esteemed physicians.
I was going to say.
I'll let one of our esteemed doctors.
I don't have enough letters. I don't have enough letters in my name for that. No.
I can try as a layperson. Essentially, here's how I think about health disparities. Race is a social construct with no foundation in science, and so you should not observe anything as a society linked to that if things are fine. But when you look at health disparities, particularly things that are easy to observe, like maternal mortality, where Black moms are 3 times as likely to die as white moms, even when you adjust for socioeconomic factors.
Yeah,
I mean, that is the easiest way to explain it is because society is systemically racist, it doesn't have institutions that take care of people in the same way. And the evidence of that is present in the outcomes. I know some of the research Brad has done, when you adjust for the provider who's taking care of the patient, a lot of these disparities go away. And so that goes to say that the institutions that are caring for people are systemically racist. And we unfortunately don't have a society where people have enough empathy to see the human. They see the color and react accordingly. I think we had an episode in the past where we talked about people being routed based on their color of their skin or the insurance when they show up in a hospital or the ER. So these things are real. And then personally, when we had our kids, I made sure my wife wore her, that she wore her like vest that said she was a physician, so that hopefully that would allow them to value her life a little more when they were taking care of her. Because I went in with that fear because I know the statistics. And then our kids would be in the nursery or the incubator there because they all came out either preemie or had a little bit of jaundice. And I had to constantly keep checking because they'd be ignored. They'd just be crying. The thing will come off their face. And it kind of goes back to the whole thing where we keep saying Black Lives Matter, right? The whole reason we're saying it is because when you look at how funding happens, when you look at how these disparities exist, how many people are in jail and all this stuff, that's why people are saying it. If it was apparent, it wouldn't need to be said. So it's frustrating, but we think we have a plan to fight it. And so that's what keeps me going, is that we have a plan and they can't stop us.
Yeah.
Yeah, I think health disparities are exactly that, an unacceptable outcome of just historical disparities in general. And by disparities, just meaning we have differences in our outcomes, we have differences in our access to care, we have differences in our respect and how we are actually able to connect with our providers of choice. We have differences in just even the availability of services within our communities. I mean, I'm living in Washington, D.C. as international of a city this is. I have to drive all the way over to Northwest to get to, I can stop at Howard, but for a lot of other specialty services that aren't available at Howard, I have to keep going across to the other side of the city to, a less melanated section of the city in order to get services. And if I lived across the river in Ward 7 and Ward 8, absolutely not available. So we have medical deserts, kind of similar to the food deserts, like Yusuf described in major cities such as Washington, D.C. These are all I think both a cause and a result of disparities and institutional racism. And this is the reason why we die sooner. This is the reason why we have more disease. This is the reason why we have more mental health concerns. Why our children are unfortunately even facing higher rates of disease as they're growing up, particularly when we're thinking about the disparities, as we were discussing, social determinants of health and their exposure to trauma and their exposure to violence as children. They have more exposures to experiences that actually cause physical disease as they get older. We have that evidence as well, too. Black communities, we have higher rates of pretty much everything that you can imagine, to the point in a neighborhood I used to practice in Chicago, there were rates of cervical cancer. And cervical cancer, Madi, you know this, as women, we get tested for that on regular intervals.
Yeah.
Rates of cervical cancer in Inglewood, which is on the south side of Chicago, equal to that of third world countries. Cervical cancer is a completely preventable, screenable disease that we have been screening for decades. Black women had it at rates of third world countries on the south side of Chicago. I mean, that's there's no defense of this, that we as a nation actually allow this.
Yeah, I would, agree and piggyback on everything that Dr. Matthews said. And it's where we talk about, differences in, like she's mentioned, access to care, both preventative care and care that provides treatment, differences in incidence and severity in diseases, differences in environmental risk factors or risk factors in general, all these differences across the spectrum of health, wellness, and disease, that we see that there are marked significant differences for one group or one population versus another. And when we're all Homo sapiens sapiens, and the difference between what's happening in this group is melanin, then, you can point back to the systemic racism. But Michael, I would offer this, that systemic racism is rooted in the tenet and the philosophy that we are less than human, right? And when you look at the roots, going all the way back, extending all the way back to the transatlantic slave trade, when even there was we made it to 3/5, at some point, but some would still argue that we haven't been actually recognized as full human beings yet by the powers that be, so to speak.
No, I've tried to think about this as objectively as I could.
Yeah, it's just so crazy. It's so
no, seriously. Here's my objective assessment of humanity, and we are raising. We have our expectations for humanity might be too high, because ultimately the history of humanity is like subjugation and oppression. And I think because we are the ones living now in the period that we are the oppressed, we kind of fathom that different groups have probably gone through this. And so, not saying any way, shape, or form it's a defense. I'm basically just saying, we have to deal with this emotionally. We have to lower our expectations while trying to make things better.
Absolutely not. I refute that.
I agree that his story is one of oppression, but our story is not. Prior to the slave trade, there was different things going on back on the continent.
No, that's what I mean. What I mean is, like, prior to the transatlantic slave trade, it wasn't like this hasn't been the power dynamic in the world, right? So there was all humanity is traced back to the mitochondrial DNA of a woman in Africa, right? So everyone migrated out of Africa, and then they moved away from the equator. Melanin changed, and they decided to use the melanin as a way to differentiate groups versus the other, right? So it's really the context of
melanin and Y chromosomes. We won't have the women versus male disparities described, but yes, keep going, Mike.
So I'll stop. So the gist of my bit is, we can beat this, and I think with science, technology, and economic power, we can make a difference.
Yes.
Because the world is capitalistic, and if we have enough resources, we can just do things, right? And that's what excites me, is the opportunity to understand things for what they are, accumulate the resources to just do things.
I would add decision-making authority as well, though, too, because I think we can pay for solutions, we can throw money at communities, we can help, but if we don't have the ultimate power in those communities as well to make decisions for ourselves, I don't know that we'll get to full solutions. I think we need the money and the decision-making power.
Yes, and we don't have to think of this place where people were forcibly settled as the final place as well. So that's the other part. The world is increasingly becoming a global village, and I think we have to be willing to migrate. I migrated here from Nigeria, and I'm exploring other places I can migrate to, because honestly, and this, I've learned this about myself since the pandemic, I'm probably one of those folks who I can't live full time in the United States anymore. I just can't do it. And so I'm trying to figure out breaks that I need to take for months on end to different parts of the world. It's just part of my therapy now.
Well, for those of us that were given our 40 acres, I've been here for generations. Yes, light, Marion, light. But I think part of it is that we shouldn't be forced to choose between this country or another. And I think we need to definitely have the ability for equal opportunity and equal treatment here as well, too. And we have to demand that.
Yeah, so I think the takeaway here is, first we get the money, then we get the power.
Oh my goodness. Oh my goodness.
Not to quote anybody today, but I'm all for it. So, I think it's
I guess the respect comes after that.
And then the
respect comes after that.
The respect comes after that.
But I will offer this, Michael. I will offer that the world has been a global village, and it's just now that technology and what we have as human beings have done to this planet has kind of exacerbated and made that more apparent. Right? We've got pollution in one part generated from one part of the world that's showing up in another part. Big garbage patches out in the ocean. Crazy stuff like that. Global warming, you may have heard of it. All the stuff that's crazy weather patterns we're seeing. So it's been a global village, but now air travel has just made it a lot easier for pandemics to become global, right? Among other things. So I'd offer it's been that way. It's just that it's just becoming a little bit more evident as we continue to screw the pooch on the planet.
Mercy. Well, let's think about and talk a little bit about what individuals can do. I commented on a post that you made earlier in the week, Dr. Matthews, and I said this was, I had an unfortunate incident with a doctor in my 20s, and I changed and I made sure that I got all Black doctors. My OBGYN is Black, my dermatologist is Black, and sometimes you got to search high and low. I've lived in Seattle, I've lived in Phoenix, in addition to DC and Philadelphia and those areas. But speaking to this membership, this budding and growing membership of ours, we have an app that has launched. It launched on Christmas Day, right? Was it Christmas Day or was it
Christmas Eve?
Christmas Eve. Sorry, Christmas Eve. So we launched our app on Christmas Eve with a first health assessment, and when folks fill out this survey, they get a personalized health report. What else, or what are the things you all believe that we can do as a community to advocate for ourselves as patients? what is the list? What are the things that we should do? I know we should download the app and fill out that health assessment, because starting to get our data right, and to take control of our data and to share that, kind of in an offensive way with your doctor, so that you're planning for your health instead of being on the defense. Oh, you're on the border for diabetes. I got that news from my doctor this past week. Oh, your numbers look a little high. You might want to stay away from the sugar, And so what do we need to do as a community, knowing that health disparities exist?
So I think we need to first and foremost really, as a community, think about or become more understanding of the importance of primary care. And I'm a family physician. I'm very proud to be such, and really believe in the importance of having what I would consider to be a partner in this effort in healthcare, having someone who's going to be by your side, helping you understand the healthcare system, because it is confusing. There's times when I don't even get it, and I'm in it every day. But having someone who's going to be thinking about your health and your well-being, not just your disease. And I think we all too often really depend on healthcare only in times of pain or crisis or discomfort, as opposed to looking at healthcare as a set of resources to prevent all of the above. And that's really where primary care is filling a need as far as prevention. So that's about establishing a relationship so that you can understand, what your problems might be, understand your genetic tendencies, understand what may be running in your family, understand maybe what your initial lab work might be, and go from there and try to prevent disease from ever occurring. That to me is it's a long-term solution. I recognize that, because most of us only want to deal with what's immediately in front of us. But I think the importance of actual prevention is something that we as a community need to prioritize.
I want to ask a follow-up question to that, Dr. Matthews specifically. I actually, had original aspirations of being a clinician myself, and my area of interest was also family medicine.
Yeah.
That's what I wanted to
I
practice.
knew I liked you.
I strongly believed in the power of prevention, right? And as the saying goes, an ounce of prevention is worth a pound of cure. We've heard that from our grandparents, right?
Yep.
What I want to ask you is, what can we do to address what we've observed as to be, I guess a general lack of holding of health as a priority for our community? What can we do to address that issue? Because that's like,
that's a great question.
If we can figure that out, we can make a lot of change in a shorter period of time, with a lot of stuff that we have available to us.
It's the $1 million question. And I don't know that there's even a single answer, right? Because our own personal level of engagement sometimes is just gonna have really its own foundation, maybe in our own family, right? Maybe it needs to be through our family units, where we really understand what's going on with our elders, right? And we really have those conversations about prevention, so that you yourself, when you become an elder, you may be able to prevent what's happened there, that you're actually, sharing that information with your children. So there's kind of generational education. It may be through our faith-based communities, right? So that in churches, we can really preserve really the camaraderie of the people that we worship with, and that we're really valuing the community as a whole, and educating, from the pulpit, from behind the stage, from everywhere, so that we can progress together as a people. It may be in schools, where we actually are discussing the importance of vaccinations at an early age, the importance of good nutrition, of good oral health, of good exercise, and physical education. Hopefully, if our students still have that at lunchtime or at some point, right? I think we actually need to have it infused in multiple different environments where we feel safe, where we can actually have these conversations. I think we need to understand that, again, because we don't necessarily have that immediate need, or that immediate pain, or that immediate symptom that we need to react to. That's not the only reason to take an action. And I think we can advocate for that in many different spaces, in the same way that we've really had to have that conversation about the COVID vaccine, right? We've had to do that in multiple different environments, barber shops, workplaces, any really environment where, again, people feel safe and can have that conversation. So it's about a larger public health campaign. That's what this is. It's about public health, about our own health, as opposed to just a disease.
Absolutely agree. Absolutely, we have to definitely, be more proactive as opposed to being reactive, and when it comes to our health. And I didn't ask that to imply that there was any one solution, because that's often the trap we fall into, right? Trying to find one answer to a problem that does not have a single answer. And and I would offer that it will take all of that, everything that you mentioned, right? All of it together and more, that we really need to really address this comprehensively. And in terms of how we get, and I think, I guess we're on the right track then. We're trying to engage folks, around family health, trying to engage folks around, faith groups, faith-based organizations. We're trying to meet our community where they are, right? And kind of trying to demonstrate and communicate and educate them about the importance of this stuff. And like we said, all the things that we've been talking about all evening. So thank you very much for that, for input on that. But hopefully we can, figure it out, answer that $1 million question. If we could do that, that would be awesome.
Agreed.
I would say, is there anything we could look at from an incentive standpoint to potentially try and make a difference? But then the flip side of that, so yes, can we incentivize people to care more about their health? But then the other side of that is, when we go back to what we talked about earlier, poverty, systemic racism, what impact does that have on people not potentially even being in the headspace to want to prioritize their health? Because to prioritize your health, I think it comes from a place where you have hope and you want to live. And there are people, I'm not a psychiatrist by any stretch of the imagination, don't even pretend to play one on TV. But the context of, if there are people who like eat themselves to death or just take on these destructive behaviors because they've been exposed to trauma or they've lost the will to live, and we're talking about how poverty and systemic racism are this weight that you have to live with when you're Black, pretty much in most of the world, but particularly here in the United States, where you have to put on your armor when you're in the house. I mean, that, and you have to do it as a child, because children are getting exposed to stuff in school. And so on one hand, we're like, how do people prioritize? Well, I'm like, there's these heavy things over here.
Right.
That
very heavy.
That if we don't address this, just it's like, because there are things like, I know I should work out, like in all this stuff, but I don't do it. I'm being honest. I don't. I should. I even have this, the tracking thing, and so I'm telling myself I should do these things, but I don't. Right, and so I'm trying to figure it out for myself as well. And so I know it's hard, and I don't know. I just have questions. That was kind of a rant. I apologize.
I completely agree with you. I think, unfortunately, for a lot of the people that we know, for our own family members, for yourself, Michael, sometimes prevention is a luxury that we can't necessarily afford, and we can't afford the attention to, or maybe we just don't want to, in your case. But
I want to. I'm just busy.
I think that goes back to Dr. Wilson's point, though, that there's a complexity to this, that it's not as simple as just telling our people that, or trying to convince and educate our people of what to do with regard to the healthcare. We also need to be advocating on their behalf to try to combat the institutional racism, the just cycle of trauma and violence that we see in our communities, that we face with police. We need to be acting and advocating to actually bring those institutional structures down as well, because you're right. We can try to prevent as much as possible, but if those are still the structure in which we find ourselves, we're not going to be able to make a difference. We have to attack all of the above. We got here through significant complexity over generations of difficulty, and it's not going to be a simple fix to get out.
Yeah, thanks for the segue on the advocacy piece. Definitely agree on that, and we've kind of taken an approach to kind of work with advocacy organizations that are working in specific health disparity areas, and hopefully we can work with you to connect with some others in some other areas. Well, we started off in the area of women's health, and we've working with some organizations. PCOS Challenge is looking at polycystic ovary syndrome, Endo Black looking at endometriosis, and the White Dress Project looking at uterine fibroids. And hopefully we can, working with you as our newly minted advisory board member, impact advisory board member, can work with you to identify some more organizations that are advocating for health disparity diseases that are impacting our community, so we can support them and bring awareness to them as well, and bring them into the fold in terms of this effort, because we kind of believe that's going to take all of us. It takes a village, right? It takes our clinicians, it takes our educators, it takes our scientists, it takes our healthcare administrators, it takes our communications experts, to really come together and attack this from all the angles that we know how, right? So just wanted to take that. I felt you gave me the alley oop, so I just I went with
it. That's great. That's great. I know you co-founded Tour for Diversity. I know you've done a lot of different things in a lot of different places. So if you wanted to highlight any of that, talk about it in the context of health disparities or just in general. I'm not sure how much the rest of the team knows. So
sure, I'd always love to talk about the work that I've done. I co-founded and continue to co-direct now with one of my good friends an organization called Tour for Diversity in Medicine. And what it is really a grassroots effort. We call it to take a group of doctors, dentists, and now pharmacists, we expanded, around the country, and to really motivate and educate students, underrepresented minority students in particular, underrepresented minorities in medicine, that is a different definition, but try to motivate them into our fields. And so the idea is that this is one solution of many. It is not a panacea, but one solution to address health disparities, which is to diversify the workforce, to make really healthcare professionals look more like the communities that they're served. We're more likely to work in indigent communities. We're more likely to have increased levels of trust from our patients. We're more likely to have better communication with them, and they're therefore more likely to adhere to the treatments that we give them. So they're going to listen to us more. They're going to perhaps even just fill that prescription a little bit sooner. So part of our effort now 2012, I can't believe it's 10 years, was to realize that we need to go find these students, that if we're just going to continue to recruit students the typical way that medical schools do, and you can imagine what that looks like, then we're not going to make an impact. We need to go find these students. We need to go motivate them. And that's what we've been doing. So now over 10 years, we've been to 27 states. We've had more than 3,000 students come through our face-to-face programming. And really our outcomes, because, we're scientists, we measure it, are really to that motivational piece. We're just a one-day program, but the idea is to have them see us brown and Black folk up front, and for them to believe that they can do what we do. And we achieve that every program. So it's quite successful. We have great virtual programming now. Next week, actually, we have 3 nights of workshops, and it's all free to the students that participate. And we're just really proud. It's a great, we just really have a lot of passion. I have about 50 docs and dentists and pharmacists with me now that have joined us over the years, and we just continue to do more and more programming.
What's the website, Dr. Matthews, where folks can learn more?
Sure. Yeah. Our handle is, website is www.tor4diversity.org. And then the at Tor for Diversity on all social media channels, LinkedIn, Facebook, Twitter, YouTube. We have a bunch of videos up where we actually have interviews. We call them our mentor stories of some of our docs. I mean, we have wide ranges of really, I think, impactful personal stories of docs that have, not been that traditional student, might have been told by an advisor, no, maybe you need to think about another field because you're not smart enough. I mean, that was, there's just so many different examples of students of color being just pushed down and not being motivated. So that's part of our program. We give them a lot of really good information about how to apply, but more than anything, show them that, there's a path forward that they can continue on it. It's going to be a longer path maybe than some other fields you might choose, but that it's worth it. And that ultimately you can address healthcare disparities just by graduating from school. That's just part of, again, one solution that would be additive to everything we're talking about as far as public health campaigns and fixing institutional racism.
Right.
It can be done.
It can be done.
So awesome. That's awesome. They say you got to see it to be it. And, just like what happened with, the Obama effect when he got in office, and he and Michelle, the impact that they made. Absolutely. We got to see Black and brown faces in professional careers, professional capacities, scientists, clinicians, et cetera. And I was just wondering if you had considered, reaching out to, nurses as well, nurses and physical therapists, in terms of expanding out to them. And
so
then
we've talked about that over the years, and we actually have purposefully chosen not to. We talked about maybe starting other tours just for nursing. Nursing in and of itself is just its own extremely critical field. We've talked about physical therapy, but haven't really gotten there. We were really focused on these professions that are just, oftentimes deemed the hardest as far as difficulty level and the like, and the motivation with the longest paths as well. The motivation that it takes to stay on that long path, we were really trying to emphasize.
I've actually had some brainstorming, some ideas. We've been talking about some stuff on the Indigenous Health team, talking about a college tour and thinking about what your organization is doing in terms of potentially combining efforts and touring colleges that have schools for clinicians, whether they be, like you said, doctors, dentists, or pharmacists. And then potentially, kind of doubling down on the effort, so to speak. And then, not only reaching the professional students at those institutions, but also the general body and, the rest of the campus as well.
We can definitely talk about different ways to partner. We're really just trying to be as far reaching as possible, and all of this outreach is necessary. So yeah, happy to combine forces and partner.
And we have some like aspirations to integrate telemedicine. I'm not sure what you guys are looking at in terms of leveraging the technology, to really be able to do more of the good that you guys are doing, right? So that's something that we're looking at down the line as well. And your network of clinicians, we love to potentially get them involved in that. When we get there, we got a little ways to go.
Mm-hmm. Definitely. We have to expand access to care, and that's through different modalities. That's through reaching into every home. But then we got to start talking about the other, kind of sort of digital divide, right, that our communities face as well too. It's not as easy to just say we'll reach them by telemedicine. We have to think about the equipment. We have to think about the broadband access, the security around it. You need those to be secure lines. I don't want my mother just talking to somebody randomly on an iPad. I want there to be safety around that as well too. So yeah, I the disparities involved with telemedicine are also something that I think we need to have some focus on.
It's that poverty.
That's valid point in terms of the internet connectivity. But then, we've got to, like you said, motivate these corporations that have the resources, right? To leverage them for finding some solutions, whether it be, hotspots a hotspot with a device or something that they can use, in a household to facilitate, telehealth visits or something like that. But I'm sure we can figure out something. We can come up with something.
We the indigenous family of companies will be that corporation that brings all of this to the communities as we build relationships and ultimately, because that's a business model, right? We build relationships and we bring people on board, and the business model will return investments into those communities. At least that's the hope, that's the vision. Mm-hmm. So in the same way Blockbuster disappeared and Netflix rose from the ashes, we will rise and others will disappear. That's the goal. And we'll just take care of people.
Mercy. We'll just take it. Yes. We will take care of people and help people live longer lives. That apathy or that sense of, when people were not, when we were first going out and talking about indigenous health and to see some of the responses that people in our community have, it was striking. It was striking for me. And I didn't know that was, I didn't think that would be a hurdle, but, seeing it and understanding it, that it is. But also I got pretty sick one day and that day, like it happened, it was an infection and I was fine. But when I got sick that day, it really made me start thinking more about my health. And so I think some of those folks that have some exposure, to health challenges are much more interested than those that have not. Right. The folks that are, we were on a college campus a few times. That was, they're like, I'm great. I'm great. I'm 18. You need to go to a doctor, And so, but I think that apathy and that mistrust, right, in the system is something that we can address because we are who we are, because we have the collective experiences we have. So we're building this community. And I think that is a great start, So any just closing comments from you all? Believe it or not, we have talked for an entire hour.
It didn't feel like it. You know what they say, time flies when you're having fun. I just want to personally thank Dr. Matthews for being here, for joining us, for joining the fight. You've always been in the fight, so for bringing the forces together is how I'd frame it. And yes. I say some of these things in jest, but I would like to see us crush some of these corporations and just rise and take care of people, honestly.
At least you're being honest about it.
Hey, you know me, I'm transparent. So.
Right.
Pleasure to get to finally meet you, Dr. Matthews. Heard a lot of great things. Again, there's always a special place for me when folks sign up to take care of my veterans. So being a disabled veteran myself, and leading a veteran healthcare company with the great group of folks that we have here, I want to say thank you for. I know you could have went a lot of places and made a lot of money, but
she's making money.
But yeah, so yeah, for me, it's always an honor and pleasure. You'll get the chance to meet some of our other veteran advisory, like Sherman Gillum and Sharisa.
Oh, I know Sherman. I know.
Yeah. So those guys are busy, and so I see that we're probably gonna have too much fun when we get the whole IAB board together. And so I think from the standpoint what you just mentioned, there's so many areas, right? There's about 7 verticals I covered in that Hacking Racism Challenge last year, and so I intend to attack and challenge all. There go new member of the team.
Dog. No, it's my dog.
He's like, all right, it's taking too long. What's going on?
No, he really did.
But again, I think we're gonna do it, vertical after vertical, because as mentioned on this call, I mean, it's not just gonna be one solution. Going to be multiple solutions to get us to an end point where we'll see some impact in our communities and health outcome and living longer lives. So appreciate you taking on the challenge and joining us on this journey. And really do appreciate it and look forward into going into this journey and like Michael said, crushing some of these corporations.
Oh,
I
mercy.
love it.
Definitely echo those sentiments, and look forward to working with you, Dr. Matthews. And I think you make a great addition to the team, and we are going to receive a significant benefit from you joining us.
Oh, thank you all so much. Thank you for letting me join the conversation tonight and as part of the IUB. I'm just I have felt honored, Yusuf. The pleasure was all mine these past 5 years, to be honest, to be serving you and your fellow veterans. I just absolutely learned so much about service itself, about patriotism, about whole health, about thinking of the whole person that we're treating and not just people as patients. I think that really impersonalizes it. So I'm just eager to bring that same sort of attitude, that same passion to this work, to all my work in the future. I just feel like my time at VHA just made me an even better doc. I was pretty good before, but I'm even better now.
Okay. That is wonderful. That's great.
No, but thank you guys for tonight too. Great conversation, one that I think our members will definitely learn a lot from.
Awesome.
Of course.
Agreed.
All right. Well, thank you all for joining, and we'll see you next week. Dr. Matthews, you have an open invitation. Any Monday you want to join us,
I'll jump on. I'm just gonna drop y'all a note.
Yeah. We'll send you the link right through. Thank you for joining us, and we will end this episode. Thank you all, and we are